Dee says she has a friend with EDS who suffers very badly with headaches and dizziness. That friend is seeing an OA specialist chiropractor in Shropshire called Ian Smith, who specialises in craniocervical issues. He gets specific and directed manipulation to the OA joint and is using scanning equipment to achieve the angle, and it really helps him. Now, first of all, is that something you're familiar with?
I've heard about it, and I don't know the technique particular. I think all techniques work to a degree, but there are certain ones that we should be very careful of, and that's particularly the rotational ones in an upper cervical spine. And I'm not saying that we shouldn't adjust them at all. We should just use modified treatment. So if that particular treatment is modified to be safe, then...
I have to be careful what I say here, because I don't want to offend any of my chiropractor colleagues who are watching, nor any of them who might be in the studio with me at the moment. But I did go to some CPD probably 15 years ago. It's a very famous osteopath's practice in London. And there was a chiropractor who was presenting the CPD, and she was part of an organization called the Upper Cervical Complex Association, or something like that. And what she told us was that that's the only joint that they manipulate, and that everything stems from that, and that they did a huge amount of training so that they could take their x-rays, which they took frequently, and get them just right and diagnose the angle of the joints just right, and so that they could stand in exactly the right position to get their adjustments just right. That sounds as though the Ian Smith that we were talking about a moment, it sounds as though he might be one of those upper cervical complex specialists.
It's funny, isn't it? People have very specific ideas about, feeling that their technique is the best one and their technique is most appropriate. And I think that depends on the patient, to be honest. It may be the best technique for certain patients, but I'm not convinced that it's the best one. But I don't know enough about it to say.
No, sure.
And, my background is SOT, sacrooccipital technique, and craniosacral, so I tend to use those non-force techniques. And they work really well for me, and they work well for the patients that I see. But that's not to say that they work for every patient.